Welcome everyone to our webinar. This is FirstLight Home Care. We also want to welcome our panelist, Andrea. She's our creative liaison, helps with a lot of the activities that we do, as well as myself. I'm the owner of FirstLight, Boyd Lowry. We want to talk about recommending the right provider, key considerations for elderly patients. It'll be a 1 hour video, probably a little shorter, about making competent referrals that ensure elderly patients receive exceptional care. You'll also have an opportunity to do a calendar invite when we're done. So welcome. So who is this for? This is for medical field professionals working with the elderly in Bergen County, as well as professionals like, not just medical, but like elder law attorneys, advocates, veterans groups, associations, and then of course we've got all the rest: social workers, executive directors, geriatric care managers. Quite a bit of people work with our seniors. It's a very growing, large population, and there's a tremendous need. Places where you work: law firms, obviously, hospitals, inpatient rehabs, veterans offices, the Veterans Administration, independent livings. We're also in nursing homes, assisted livings. Everybody is managing these various services to help our seniors in their delicate state as they age in place. Adult care, we go and visit all these places. Today, we just want to answer 3 basic questions. Finding quality care for the elderly, maintaining ongoing quality care for seniors, and how to find a provider that goes above and beyond. I'm the owner, Boyd Lowry, worked in human resources and for years. That was my degree. And then I'm an entrepreneur and a Marine Corps veteran. And all these aspects come into service in making these happen. It's a little background about myself. My father's a minister, my mother's a nurse. And this is our Rockin' Senior Center. We have a lot of fun there, but we use this to actually help not only our seniors not yet getting home care, but also helping them age slowly with proper brain health and staying healthy and not needing care. The goal is all those things. Activities, we do talking activities, lectures on speech, and games outside. So what are the barriers to the quality of senior care? It's obviously too costly. It's short. There's always a shortage of caregivers. Caregivers are not provided adequate support. Lack of consistency in care. Families are undervalued when we want to show the connection between the two. And then, of course, we got communication between caregivers and care managers. All those things come into play. What are the impacts? Oh, I think we want to do a question here. The first poll we're going to put in: are you interested in making confidential referrals and ensuring your elderly patients the highest quality of care? Andrea will put out a poll, and you can just answer that, and we'll kind of gauge what the interest is. Oh, let's see. Oh, okay. There's the poll. Wait a few seconds. The impact of barriers. Okay, and poll. Share results. So, yes, we all want to kind of figure out how to do that. Okay, so impact of these barriers. So some of the impact is your readmission costs. So if we come back within 30 days after being in the hospital, there can be a readmission cost, a penalty to the hospitals, to the healthcare provider. So we don't want those. So fall, UTI, catastrophic events, those also increase now care needs because now something's gone wrong. Unrecoverable health issues. So if something serious happens, that's another barrier. Everything increases. Now we have loneliness and depression to deal with. That's a area that becomes critical in helping our seniors age, increase care needs, and add expenses. We lose our continuity, and now we have multiple caregivers because we've got different changes going, different issues, and a higher acuity. What are the senior care options? So when we talk about senior care, we've got a series of options that are available to us. Um, Family can just take care of them. They can either try and maneuver it in the evenings, they try to kind of start the morning, go off to work, come back. But obviously, that's not optimal. It'll create a strain on the relationship with the family as well, because now you're not the daughter or the son. You're not professionally trained. So you also might do not a proper transfer. You might hurt your back, have other issues with your um, over time and create stress. And if you're the spouse, you're also at a higher age level and you might create other medical issues for yourself, creating now a larger problem. So, and it's inconvenient. Senior care options at one is home care. We can come to the home or we can have care in the home with independence and memories. Favorite chair, you got your favorite room, you got the colors on the wall, you have the knob that you remember from the, the various doors in the house. Um, slow, all these become anchors that slow your memory loss and helps you to stay healthy into your 80s, into your 90s. It slows the progression. So you want to stay active. Family, friends, visitors can easily come by. Food, pets can be there. Now, independent living is similar to your home, but you just have a smaller place. You have the similar things, but you've downsized. So those can work as well, and there aren't usually facility home care. So the acuity, you can usually have issues maybe with couple care and acuity there. But there's activities and social events, so can be a good option. The third the third one is assisted livings. Now, assisted livings are more organized. They have nurses, doctors, everything there. Um, but you've got an increased cost. You've got social events, um, give up independence, unfamiliar spaces. So couples might be separated due to acuity. One has dementia, one is healthy and alert, but the spaces are unfamiliar. And then you have a 1 to 15 ratio with the caregivers. Senior care option. Now, a nursing home, a SNF, skilled nursing facility, would be your rehabs, your dementia care, your facility, all these. Now your acuity is much higher, and that's a place where you're getting services that you need additional oversight. So you have nurses, but you're usually more in a hospital type kind of environment. So it's a rehab, and the goal from initially with rehab, it's a goal to bring you back to independence. That's usually covered by Medicare. But then after Medicare reaches 20 days, you have to petition for any days after that. Caregiver staffing ratio is usually much higher, 1 to 15. And then you have the potential to have superbugs and build up an antibody resistant. So because you're in with a lot of people that need care and a lot of medical things. So what is the best way for elderly to care for the elderly? Well, I is in their own home and where the caregiver is cared for so they can care for the patient. So let's put another poll out, and that poll will be um, okay. How would you rate the communication you receive from a home care agency after making a referral? Okay. And so, so the next thing would be in their own home, with home care, we have one-on-one care, pretty much the optimal, and one-on-two care if you have couples. It's safer around your memories. You maintain independence in your own home, and you have regular updates to family members. They can see what's going on through the home care provider, through the cloud-based system, or whatever system they have. Families can enjoy their time as a daughter or a son without the stress of being the full-time caregiver. Why caregivers must be cared for. So not only is your family member a caregiver, but the caregiver that we provide and bring to the house would be, we need to show appreciation. We need to make sure they feel empowered and have attention, and we do that within our agency. We're effective at home care, effective at providing care. We want to make sure they have the education, training, staff, nursing staff, and ongoing support when they have questions. They need to take care of their own valuable health information. We want to also create positive moments. So we want to inspire, because really memory, conversation, company, those are times where we create closeness and comfort. And that's something that we need as we age in place. We pay attention, we show attention. Just looking at someone face to face is a key thing that helps people age well. How caregivers can be cared for. Ongoing training, manage dementia appropriately. We have sheets that can create that. Cloud-based system for sharing information. They all must be HIPAA compliant. So a great story was Joan, who we cared for. She's a lovely lady who um, wanted to try out going to a facility. She ended up going to an assisted living. She moved out of her house, but she kept her house, and she was not happy there. She couldn't get the enough attention that she wanted, and then she thought she would use some of the resources in the assisted living, but she never really left her apartment. And then the apartment was so much smaller compared to her house. And over time, she was just frustrated. So she came back home and we provided care for her before and after. And and when she got there back home, she still had her landlord, her tenants, and she was able to feel independent again, have her resources. She was losing some of the abilities. We got things for like a lift chair and all the equipment, hospital bed, and and slowly as she aged and we did 24-hour care, we were able to deliver that quality and attention that she needed. And at the end, we knew she needed more spiritual guidance and additional services. We actually brought the minister in. It was a local church, and I knew which one it was because I'd talked to her many times. And the caregiver showed attention. We were able to really kind of build that need and support. And family was very appreciative at the end. And from beginning to end, it was a an accomplishment for a home care agency to go from beginning to end. I feel is a great achievement. So what is the best way to care for the elderly? It's at home. And other things that we do here at FirstLight, is we provide brain health basics program. So when you're educating caregivers and showing their empowerment, you do want to have resources and family members as well. If they're local and they want to bring them somewhere, bring them to Glen Rock Senior Center. Um, we have Ageless Grace, mindfulness, fitness programs. These are all age, brain awareness, brain education programs. We want to promote better health, and we want to promote the compassionate memory care that FirstLight sponsors. And that also brings out more awareness and understanding. We also do talks. Uh, we brain health series is through compassionate living, through movement, and widen the window. We do additional fun talks as well. So, what are our services at FirstLight? We are personal care, so that's home care, caregivers in the home. Companion care in New Jersey is pretty much part of personal care because we are a licensure state. So all our caregivers are able to be HHA certified and provide both. Companion is your attention, your brain health, your awareness. Personal care, you're transferring a position. And then we increase the need for care. That's your dementia care, where your memory starts to regress. And that's what we're trying to slow. The population is growing exponentially. We want to provide respite care for the partner, the couple care. We want to, or the family member that's been working 9 to 5 and needs just a little bit of help to keep the care going. Veteran care, we take care of veterans. I'm a veteran myself, and I have many veterans that I can use care, and we service, and we partner with the state of New Jersey Veteran Services. And also help you with getting your forms and getting them signed up and meeting the need that's necessary to get your services that are available. Skilled nursing we provide as well. It's more likely after Medicare has you been used up and you're having issues with additional wounds or ostomy, colostomy, and different kinds of facilities. Disability care over 18, we can still help. And then rehab and recovery, those are usually done in the facilities, but we'll partner with the PTOT because we can follow the instructions and stuff and meet that need. So where are patients? Our patients are everywhere. They're at nursing homes. When they need more help, they can call a home care company like FirstLight. Mostly in the home, clients or relatives' home. Adult care home, that can also be a place. Rehabs, hospice, independent living, hospitals. We can do wherever the need is. We'll bring a care in to augment the services there, but primarily we're mostly in. So who do you use? Well, we would love to hear you use FirstLight Home Care. We are licensed, insured, and bonded, ACHC accredited. So background checks, reference checks. We provide constant communication. We have a cloud-based system. We have a service. We're serving seniors where they live. We have over 12 years of service. And we have a national franchise support group that helps us make sure that we're in compliance and meeting the needs and have the background and resources to be optimized in our services. We care for the caregivers so they can care for your loved ones. Families will now know their loved ones are safe. Patients will keep their independence. Seniors get the care and support they need, and patients are where their memories are. You can refer elderly patients with confidence to FirstLight, your trusted home care provider. I I think there was another question. No. So we're going to post like for any meetings that you would like. Um, and voice. um, so we did have a question about the senior center. There is no cost for the senior center in Glen Rock. You can come down. It's usually 10 to 1, 10 to 2. We do Monday through Thursday right now. And we expand those things. So if you'd like to come, that's a great opportunity to learn ideas and activities. Um, If you would like to, I think Andrea can share in the comments the a discovery call contact. You can link in and then we can have a personal one-on-one call. I'd be happy to talk to you and talk about different things about care and and uh, and then we can move from there. So when you're ready, you can certainly do that. So you can also find information about me in my wartime museum. That's to the the Wartime Museum is out of DC, but it's online. And you can also learn more about our senior center as well as our home care company. So I want to thank you for attending our webinar today. It's been wonderful to have you here, and I hope to hear from you soon. And if you have any other questions or further details you want to learn about, just give us a call. Here's my email, Andrea's email, as and our company number as well. You can go to website. There it is. So thank you very much for attending. Have a great day.